Pleasure to introduce Dr. Utkarsh Bansal. He is a young and dynamic member of IAP. He is a professor in pediatrics at Hind Institute of Medical Sciences, Lucknow. He is secretary AHA Lucknow branch. He has been an executive board member of IAP Lucknow branch. He is a trainer at KMC, SOS Hope and NRP. Faculty in Awesome Aya Under 5 Visa 1 SIM with Monash University. And he is a very good speaker. I introduce you Dr. Utkarsh Bansal.
So good afternoon to all. Topic is very interesting, and in 1990s this iconic movie came. इसमें गाना था मुझे नींद ना आए मुझे चैन ना आए कोई जाए जरा ढूंढ के लाए न जाने कहाँ दिल खो गया. लेकिन 2020 में क्या हुआ, एक मोबाइल आया और उसने गाने में दिल की जगह मोबाइल ले ली और आज ये सिचुएशन है. So I bring before you screen and internet addiction. India has the world's second largest internet user base. Adolescents comprise about 31% of the users, which is about 156 million. And you can see that in the 20 to 29 age group, which are the young adults, again it is a very high use. So this is the group which is using the internet to the tune of 65%. Teenagers send an average of 3,000 texts per month and spend more time texting than talking. They remain 40 hours per week online, including 5.5 hours of streaming video. 62% of Indian teens are now using the internet. And there is an explosion in mobile and online media, which has fueled the increase of media use among the young people. Youth who spend more time with media report lower grades and lower levels of personal content. Children whose parents make an effort to limit media use know the media environment they create in home and the rules they set spend less time with media than their peers. So the recommendations say that 6 to 12 years old should use 2 hours per day and above 13 years old, the parents should set limits. So this brings us to the problematic internet use. It is known by various names: compulsive internet use, internet overuse, problematic computer use, or pathological computer use, internet addiction disorder, video game addiction, or internet gaming disorder. Names are many, but the problem is same. It is a problematic, compulsive use of internet which results in significant impairment in an individual's function in various life domains over a prolonged period of time. As we have seen that adolescent and young adults access to the internet more than any other age group, there are 5 subtypes. 1. Cyber sexual addiction, where a person is indulged into online pornography. Cyber relational addiction, where they are overly involved in online relationship. Net compulsions, where obsessive online gambling, shopping, or trading is done. Information overload, compulsive online web search on the www. And computer addiction, where there is an obsessive computer game playing. There are physical signs like carpal tunnel syndrome, where there will be pain and numbness in the hands and wrists, dry eye or strained vision, backache, neck ache, severe headache can occur. Sleep disturbances, pronounced weight gain, sometimes because they are only eating in front of the internet, or weight loss because of skipping of meals, and computer vision syndrome can occur. Then there is a WhatsApp addiction. So checking the message each time you get in the middle of night to check the message, checking the last online time of friends in your contact list, frequently checking friends' profile pictures, changing your status and display pictures frequently, continuously checking your phone after sending a message. If you forward everything you have received, keeping a tab on everyone's status updates, fight or argue with your friends for not responding in spite of being online, driving, eating, sleeping, working, studying, whatever you are doing, and if you are replying on the WhatsApp message as soon as you receive it. If the answers of all these questions is yes, then you are officially a WhatsApp addict. Welcome to the club. The management is important and comprehensive approach and counseling is the mainstay. Individual therapy, family, school and society as a whole should be addressed. Prevention is always better than treatment toward any clinical problem. Therefore, there should be a set of guidelines by the parents' family teaching us and also the occupational organization on the use to prevent the hazards. The role of parents is very, very important. They have to find a balance, encourage other activities, get the teams involved in sports or activities, so their device active time will be limited. बच्चे को ये बोलने से काम नहीं चलेगा कि तुम्हारा फोन उठा के देख देंगे, आप उसे समझाइए. Pediatricians can give important resources to the families like social media and texting tips and the IAP internet safety guides. Ergonomics would be told, keep the laptop or mobile in such a way that a child remains straight while looking at it. Sit on a chair straight in an upright sitting posture, maintaining right angles at ankles, knee, hip and elbow. Head is facing forward, balance, shoulders are relaxed, upper arms touching the side of the body, and the 20-20-20 rule. Every 20 minutes spent using a screen, try to look away at something that is 20 feet away, and for a total of 20. So I conclude by saying that clear media rules, limit on screen time, and media out of the bedroom leads to less hours of media time. Schools should have media literacy programs and also need to include comprehensive sex education. Encourage media-free hobbies and listen to the teens. Pediatricians should provide timely, anticipatory media guidance to the parents and children. Internet addiction disorder needs management by proper counseling and psychiatric referral if not improving in 6 weeks. Whether internet is a blessing or a curse entirely depends on how it is used. A knife is an instrument. If a surgeon is using it, is good. If a murderer is using it, is bad. So it is depending on who is using. Spend less time on social media and more time on real social world. Internet is a superpower. Hence, handle it with utmost responsibility.
इस जानकारी को अपने परिवार और दोस्तों के संग जरूर शेयर करें, इस वीडियो को लाइक करें और भी इंफॉर्मेटिव वीडियोस के लिए इस चैनल को सब्सक्राइब करें. धन्यवाद.